Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we are with Yvette Nunes, who is a cruise ship nurse currently working off the coast of Darwin, Australia. Yvette, welcome to the program.
Thank you, Aebhric. It's very nice to be here speaking with you.
So tell us about yourself and what's keeping you busy.
I'm a lead nurse on board a cruise ship at the moment. We're on an expedition ship, and what's keeping me busy is between myself and the doctor, we manage the onboard medical center, and we get to join in with our expedition team when they do their landings shoreside. So it's great to be able to experience this in hospital medicine and a bit of pre-hospital medicine too. And in between contracts, I enjoy time in South Africa and in Portugal. And in the meantime, keep ourselves busy on board.
That's fascinating. So it's an expedition ship. So what does that mean? So you have yokes going off of the ship who are researchers, or they academics, or what precisely is the mission of the expedition?
Our main focus is we're an expedition cruise ship. So we're taking our guests to new and remote areas and being able to give them opportunities to get as close as possible to the shoreside or land-based walks or hikes where other larger ships might not be able to get as close in. And we've got numerous zodiacs on board, which our expedition team manage to, and they're a group of people that are experienced in all sorts, like marine biology, ecology, geologists, geophysicists, historians, and together with our captain and our navigation team, they work together to bring experiences to our guests of all sorts of ages, from very young to very mature, and we try to make memorable moments every day.
That sounds much more interesting than just the normal holiday cruise ship, which goes back and forth the same route on the Mediterranean. You get different cruises every time, don't you?
Yes, because we're often relocating. So this, for example, this specific ship has sailed out of Antarctica earlier this year, gone up the side of Chile, across past the Easter Islands, the Solomon Islands, Pitcairn, and the Cook Island, through to Guam, Papua New Guinea, Indonesia, and now we're going down the northwest coast of Australia into a new area for our company, into the Kimberleys on the side of Australia.
Kimberley's Crossing.
The Kimberleys, it's like a natural how can I explain? A natural area, a lot of fjords, a lot of pearl farms that we're going through, mangroves, and this territory, it's usually very hard to get to, so people would need to fly in to see the Kimberleys or experience it by ship and expedition ship. and we've got the capabilities of the zodiacs, so we can go further into the rivers to go and see the rock formations and get a bit closer to the fauna, um, do landings n- in un- not uncharted land, but um, sacred land where the local Australian and Aboriginal tribes welcome us and welcome our guests.
That's incredible. And it's a very different experience than what I had when I was working with the Australian SAS out of Perth. We would go up to the northwest and on ops, and it was some very remote areas. And but you're seeing them in a completely different environment. You get to see the cultural aspects, and you see well the whole coast is lovely, isn't it?
It's beautiful, and every day we're experiencing something different. So, if things need to change operationally due to weather or safety, uh, the captain, together with the expedition team, would try to find um, an alternative to offer the guests an experience for the day. So often we would sail a little bit further down until we'd find favorable conditions again and be able to either offer another landing or zodiac cruising off that area. And we bring our with our expedition team, we bring in experts that know about the area and can explain further details to our guests.
It sounds like a challenge to deal with old-aged pensioners as well as pediatric patients. You have to have the whole gambit, don't you?
We do, and on board our vessel, it's taking care of our guests, exactly, that come from many different backgrounds, from various countries to of various ages. So some fit and some a little bit less fit, but still strong at heart and want to come out and enjoy um, when they're still able to be mobile. So we try to offer a full experience that way. And on board our vessel, we still serve the crew, we serve people all the way, the technical team working in the engine room, we serve the deck team um, up on deck, we serve the people working in the restaurants and the galleys, the housekeeping team, our hotel team. So it's a wide range of people that we'd have to cater for. It's a city that's traveling, and a lot to be considered in terms of acute medicine as well as preventative for our crew that stay on board for many months.
Indeed. And are you carrying a Life Pack 12 as you're following these old age pensioners as they go on their adventure?
We do have a wide range of AEDs on board as well as multifunction defibrillators. We do have that, and we make sure that we carry that. We have the facilities on board as well as when we are on standby ashore. We're always have a defibrillator with us, but um, as we've experienced, it can happen at any age. So we're here to be ready to help anyone.
And on these excursions, what kind of medical problems, what type of emergency or injuries have you had to deal with?
We've experienced a syncope episode. The lady was dressed a little bit warmly and hadn't had her breakfast yet. So we had to assist her. She was a little bit hypoglycemic ashore, but often we try to advise the guests if we experience that the terrain could be a bit tricky. We might advise them against coming on certain hikes and perhaps to opt for the Zodiac cruising. We do try to warn people day by day or prior to an excursion what the risks are, and to either dress warmly or to hydrate or keep their water bottle with them. Sometimes we, if there could be slips and falls, and there's been one or two ankle injuries, but for the most part, we've had everything under control. We try to be prepared as much as possible, and we try to advise everyone. So we try to prevent as much as possible.
Yeah, prevention is the key, isn't it? So you have doctors and nurses. Do you have paramedics as well on the cruise ship?
On this specific vessel that I'm working on, we're a one doctor team and two nurses. So we will rotate our shifts, but and I will explain that a little bit more in detail a bit later. But there are paramedics, but usually they do work on our larger vessels that have more souls on board. So you'll find the paramedic skills are needed a lot more on our larger vessels.
So you're a trained nurse from South Africa, and you came to Malta earlier this spring. How was that experience for you? What courses were you taking, and how did you like them?
I had been following the College of Remote and Offshore Medicine for about 1 or 2 years, and I was just trying to find the right opportunity in terms of timing to be able to attend your courses. And this year in April and May, I had attended your pre-hospital ultrasound course, as well as the intensive care for remote and austere environments, the travel, tropical, and expedition medicine, the TTEMS, as well as the advanced travel, tropical, and expedition medicine courses.
So 3 weeks. You were there for 3 weeks.
3.5 weeks, yes.
So how was that?
I found it thoroughly enriching. I felt that being a nurse on an expedition vessel, our company is very much in favor of continuous professional development and encourage studying and training um, that would enhance the work that we do. And with our ship going into remote areas, and with us doing landings and accompanying the expedition team on their short hikes, or just being ashore so that we could respond quicker if there were an emergency, I felt that I wanted to prepare myself a bit more with regards to the remote environment and the pre-hospital environment. And
Hmm.
I felt thoroughly enriched after attending these courses in Malta, because it's also about improvised medicine and thinking out the box, and being able to anticipate what potential risks there may be with regards to certain environments, and how to best prepare for that.
So how do you think you'll use the learning that you got in Malta and incorporate it into your clinical practice?
In terms of, well, for example, number one, hypothermia prevention, learning the hypo wrap, learning what to pack for certain environments, and working with the expedition team. So when we are ashore, we're one medic, and we do have a medical response protocol. So if I need to call the doctor out, or if the doctor's ashore and he needs an additional hand, we do have protocols in place to get the second medic ashore as quickly as possible. But we do have a very highly skilled expedition team who all also attend wilderness first responder and remote medicine courses, and us continuing the training so that the expedition team can help us to help our patients while we're ashore. This is part of our daily practice, working on protocols for specific situations, and it's mostly about prevention and prepping and having the correct gear.
So you had mentioned some improvised techniques. What did you learn in Malta that you think you would implement on your job?
Well, the first thing was, as I've mentioned earlier, um, the how to prevent my patient from from further losing their core body temperature. Um, I've also learned proper hemorrhage control techniques. Um, we've learned how to, for example, when you're prepping your patient within the wrap, how to have your equipment, for example, uh, on the upper body so that you're not having to keep re-exposing your patient to environmental conditions again. We've learned how to, in addition, how to prevent pressure injuries, and with your um, bubble wrap, we were able to implement that, and that adds a pressure relief as well as an insulating layer underneath the patient. Um, on board, other things that we've learned was the wound vacuum. That was quite something practical. The improvised wound care that you've um, shown us. Basically, wrapping things up and not losing your items, keeping them safe, using the shelter to keep yourself and the patient warm and to keep your equipment um, off, out of the elements too. Those are just some of the things.
We do like having all of the leads of the BP cough and the stirth and the ECG thermometer, all of them to come out. So once you hypowrap your patient, you don't have to open it up again. And I like the technique of putting the stethoscope underneath the BP cuff so it stays in place, and the BP cuff is upside down, and all of those leads then run out to the shoulder, so you don't have to freeze your casualty every time you have to get a reassessment. It it we've seen that it works pretty well, and I'm hoping that you implement that.
Definitely, and that's part of the training that we can do within our teams. We run quite frequently, or we do training within our team, and as the team members rotate out, it is a continual training process on board. So we'll keep showing those techniques to our colleagues. I found what you've just described earlier quite practical, and I hope if the situation arises that I will prepare my patient that way.
So Yvette, I'm curious, what is a day-to-day life for you on an expedition cruise ship? What is your day like? What do you have to be in the middle of the night, or is it on call, or what keeps you busy?
We are a 3-person team, so it's 1 doctor and 2 nurses. On this specific vessel, I'm the lead nurse. We do have a medical center on board, and which would have a treatment room that includes a laboratory and X-ray facilities. We're able to send those items ashore for expert radiology reporting. We have 2 wards, and one which is an intensive care. It has intensive care capabilities. And within this facility, we run a clinic twice a day where guests and crew, they could make an appointment or they could walk in, but either at our morning clinic or our afternoon clinic and be assisted. There is always one medic on call 24 hours. So usually the 2 nurses will swap the first responder duties and we'll do a 24-hour shift. The doctor is always on call, but he assists at times with keeping the duty phone if there is a nurse shoreside on duty and the second nurse has to go and relieve her. We do a typical day might start as early as 6 a.m. with the first medic. It could be between the doctor, the other nurse, or myself going off with the expedition team. We do a 2 to 3 hour shift, and then the second team member will come in ashore to relieve that person. There will always be one medic to open up the clinic, and usually that will be the doctor. The doctor will usually be on board for the clinic times, and then he will come and help to relieve outside of the clinic times. So sometimes we might have up to 2 landings a day. So the landings could be anywhere from 6:30 in the morning till just about 12 o'clock in the afternoon. And then we'll have a lunch break and come on and prepare for the next medic to go off with the expedition team, usually around 2 o'clock for the second part of the day. And we'll keep rotating throughout the day so that one person is not outside for too long, exposed to the elements, and that there will always be cover on board and there will always be cover ashore. And we're also available on standby for other events on board, for example, the polar plunge within Antarctica, or if we're in the Arctic. The polar plunge is where guests and crew have an opportunity to jump into the Antarctic water or the Arctic water, and it's literally a couple of seconds and then you're back on board again. But the medical team is on standby.
You've done this.
I've done it. I have done the polar plunge myself, once in the Arctic and once in the Antarctic.
So, what kind of training do you need to have a job like yours?
To be selected as a nurse on board a cruise ship, they will require at least, usually at least 3 years experience within an emergency department or an intensive care environment. It happens at times that we do have to nurse inpatients that are critical. So the emergency medicine and the critical care medicine is quite an important factor when applying for the position. But depending on your past experience, we will take into consideration your expertise when you join the team. The same with the doctor, they do usually require an emergency medicine background, critical care. We do have opportunities for continuous professional development on board. And with our vacation times that we get 4 months a year, divided, it allows plenty of opportunity for us to go back home and work within an emergency room or back in your critical care unit so that you can maintain your skills.
Tell us about one of your memorable casualties.
One of our memorable casualties was a couple of years ago on a larger vessel, and the guest had liver failure, had a chronic liver failure, and she had esophageal varices at the time, and
Ooh,
she was bleeding quite a lot, and we had to use our esophageal Senstarken tube and have that inserted by our doctors. And so in order to tampen out the varices, and with that we did arrange a blood transfusion on board. So it was quite a massive blood transfusion that the guest needed. And we have what we call a walk-in blood bank. So we would ask the guests to come and donate the blood, where we are able to screen the blood on board and then be able to offer our patient a whole blood transfusion.
that's incredible.
Yes, it literally saves lives. So I have experienced having to be part of the team when we've had blood transfusions on board, and it's definitely a life-saving protocol that we have in place, and very grateful for all the supplies and the resources that we have in order to make this possible.
Indeed. Have you ever done one before this job, a walking blood bank?
Not prior to working at sea. So since working at sea, I've been part of there have been numerous occasions where our patients needed blood transfusions, and but prior to working at sea, not being part of a walk-in blood bank, but within the critical care unit that I worked in at home, yes, we did do that.
So, Yvette, what is next for yourself in your career?
I hope to continue doing this. I really enjoy being a nurse on a cruise ship. Every day is brings in something different. As I've mentioned before, we've got a vast guest profile on board, and as well as our crew profile. And it's stimulating in terms of um, the professional development that our company encourages, learning new things, advanced airway techniques, um, for example, revising the blood transfusion protocol, learning new things with being part of a medical team that works with the expedition team. So there's a lot of learning that keeps happening, and it's wonderful to wake up in a new place every day. It's um, to be able to have lunch with people from different countries, different backgrounds, different cultures, different experiences. All this is actually a very stimulating and motivating environment, and learning from different people, um, being able to have your lunch with the engineers or the nautical team or the guest services team. Also, from a nursing perspective, there's so many things, like we manage the laboratory on board, so learning how to operate those equipment, understanding why and how we read those values, um, the public health considerations that we need on board, the preventative medicine in terms of our crew, their chronic health issues, trying to run wellness programs for them, and continually improving yourself in terms of the acute medicine, because we have, as a mobile city, you have anything that walks through the door. It could be people having myocardial infarct, or um, a cerebral event, epilepsy, hypoglycemic event, diabetic ketoacidosis, or someone with a kidney stone. We've had patients with bowel obstruction, severely anemic patients. People, sometimes they don't realize that they're pregnant when they come on the cruise, so we have to manage that too.
Wow.
Anaphylaxis, because sometimes people are aware that they shouldn't eat seafood, but they know that the cuisine is so good, so they want to try what it's like on board. So, sometimes we've had to manage anaphylaxis or choking. But in terms of being a lead nurse on board, I've had I've learned so many things in terms of inventory management, managing the clinic, preparing for audits, maintaining compliance within the medical center. We maintain our standards. We have our one of our accreditation is the CHKS, so we're accredited to so many land-based hospital standards. So we're able to provide those services too. And sometimes the better place is to keep the patient on board until we reach a facility that has, for example, a specialist or a CT scan. But when we're traveling remotely, we've prepared our medical center to be the best place that they can be.
That's fantastic. And that's very much a remote medic because you're a long way from definitive care.
We are a long way from definitive care, and but we are very fortunate enough to have very experienced doctors on board, and we do have telemedicine capabilities,
Nice.
and our company has a health operations center, so we do always have people, doctors shoreside working for our company, that are available 24 hours if we need a second opinion or advice in terms of operational changes needed, if we urgently need to disembark a guest or a crew member, or if we needing to call out a helicopter or change the itinerary. We do have the health operations team and um, doctors working there with us. And with that too, we do have a 24-hour telemedicine facility available, and where we're able to access a wide range of specialists if we are needing a second opinion um, in a challenging case. So we are very fortunate with those resources.
Telemedicine is one of the 10 capabilities in prolonged field care, and it's really good that you have that option available. So, Yvette, my final question for you is this. What advice do you have for the new paramedic, the new nurse, or the new doctor interested in working in an austere environment?
I would say the world is your oyster, and there are so many opportunities nowadays, starting from learning opportunities online, being able to participate in virtual classrooms, and at least commence a course or a program that way, and being able to then complete the practical component of that afterwards. I think in the last 5 years, there's been so much advancement and opportunities that have opened for learning within the austere environment. There are so many companies these days that are looking for medics and willing to invest in their training. It's easy to search online. It's easy to, for example, go through your college and the programs that you have available, both online learning as well as in classroom. I think there are no limits. The only limits are what you create for yourself. I think there's only opportunities. And it doesn't matter what your initial background was pre the austere environment, all that plays a part in what you can bring forward later. So, for example, myself, I'm usually in hospital nurse, but with this work, I've learned many other skills to be able to strengthen myself in the pre-hospital situations.
That's good advice, and it sounds like you have quite an incredible job and an interesting life on the expedition cruise liner. And Yvette Nunes, thank you for being our guest today, and thank you for spending almost a month with our training in Malta.
Thank you, Aebhric. I feel very blessed for this wonderful work that I have and the wonderful colleagues that I have. And I really feel so enriched after spending all this time with the college in Malta. And I really hope to return for more courses in future. And thank you for reaching out and wanting to learn a little bit more about what it's like for a shipboard medic.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.